You get the surgery, and you expect the problem to be solved. But then you sit down to a rich meal, and halfway through, you're suddenly rushing away from the table. If this sounds familiar, you aren't alone. Published research shows a meaningful subset of patients continue to face urgent, uncomfortable digestive issues for years after their operation. The confusion usually starts with a misunderstanding of anatomy. The gallbladder actually doesn't manufacture bile. Your liver does that, and it produces it continuously. So the problem after surgery isn't a lack of bile. The problem is that your body lost its dedicated storage tank and its precision delivery system. Think of a healthy gallbladder as a holding reservoir. Between meals, it stores and highly concentrates the bile produced by the liver. When you eat, fat enters the intestine, triggering the hormone CCK. This signals the gallbladder to squeeze, forcefully pushing a concentrated wave of bile into the intestine. The bile hits exactly when needed, mixing with fat and emulsifying it, so your body absorbs nutrients. The body relies on that targeted, concentrated burst, arriving in perfect sync with your food. Then the surgery happens. The storage organ is entirely removed. Your liver doesn't stop working. It continues manufacturing bile at the exact same rate it always has. But look at the plumbing now. With the reservoir gone, that bile has nowhere to wait. Instead, it forms a slow, continuous drip, falling straight from the liver into the intestine at a constant baseline rate. When you eat a heavy or fatty meal, that slow drip simply cannot keep up. The available bile is too dilute, and the timing is completely off, allowing large amounts of dietary fat to pass through unbroken. The anatomy goes from a synchronized precision instrument to an unsynchronized continuous leak. That unbroken fat continuing down your digestive tract is what causes the heavy bloating and gas so many people experience after eating. But there is a second, often more disruptive consequence to that continuous leak. Because bile is constantly dripping out between meals, stray bile acids eventually slip entirely past the small intestine. Clinically, this is known as bile acid malabsorption. Here in this diagram, we can track what happens when those stray bile acids reach the colon. They act as an intense irritant. The bile acids overstimulate the colon lining, flooding the area with water and drastically accelerating the physical contractions of the colon itself. That rapid chemical reaction is exactly what causes the sudden, urgent need for a bathroom and the loose stools that disrupt daily life. If you are dealing with this years after your surgery, it is not in your head. It is the direct result of a documented physical mismatch in your internal plumbing. Now, for a lot of people, the digestive system adapts to this constant drip over a few weeks or months. But for a significant subset, the challenges persist. Standard clinical guidance usually starts with the diet. That means eating smaller, more frequent meals to match that slow drip, and gradually reintroducing fats rather than avoiding them entirely. However, if your symptoms are severe or actively getting worse, you need to see a gastroenterologist. They can formally test for bile acid malabsorption and, if appropriate, prescribe medical bile acid binders to intercept that excess bile. Finding your new normal requires a combination of dietary observation and a proactive partnership with your doctor. For those actively looking into dietary supplements formulated to support bile availability during digestion, we want to introduce today's sponsor, Medisyn Labs. They developed Gallavance. It is engineered with delayed-release capsules containing bile acids and phospholipids that are designed to bypass the stomach and open directly in the intestine, which helps mimic the targeted delivery your body lost. Their original formula anchors its support with ox bile extract, along with a complex of additional digestive ingredients like phosphatidylcholine, artichoke, and dandelion root. And for those seeking an animal-free option, they offer a plant-based formula designed to approach bile support using alternative botanical ingredients. It is vital to note that these statements have not been evaluated by the FDA. Gallavance is a dietary supplement, not a cure for bile acid malabsorption or a replacement for physician-prescribed treatments. Always consult your doctor before adding any supplement to your routine. Removing your gallbladder permanently changes how your body works. But by understanding the actual mechanics of your digestion, you can combine lifestyle adjustments and targeted support to reclaim your comfort and get back to your life. Note that these statements have not been evaluated by the Food and Drug Administration, and this product is not intended to diagnose, treat, cure, or prevent any disease.